Good morning all. I have no disclosures. Pictures are allowed. So, as you said, in Cyprus we have Mario, so all, the new things we want to implement in Cyprus. So in Cyprus we don't have a rheumatology nurse as a practitioner. So the background is that a rheumatology nurse is a practitioner well educated or with a specialty on rheumatology diseases who help people with RMDs to live as fully independently as possible. A big part of the rheumatology nurse job is to help patients with rheumatic diseases to release their pain and manage their symptoms. In Europe, the use of rheumatology nurse for the treatment of rheumatism is becoming more and more popular. In my country, Cyprus, this is not the case. There are still a lot of work to be done to apply the rheumatology nurse in the life of a rheumatism person. That's why our organization is pushing the government to implement the rheumatology nurse in the system. So, Cyprus League Against Rheumatism asked from the Ministry of Health to establish the use of rheumatology nurse in the outpatient clinic, as we don't have an inpatient clinic, so we ask it at least for the outpatient clinic. Ministry refused with the justification of not having any nurse specialist educated or interested to be educated on the rheumatology fields. So the challenge for us is to improve to our ministry that this is not a full justification not to have a rheumatology nurse. So our steps, it was to inform nurse services of government the significant job of rheumatology nurse, to discuss with them the need of educated nurses on rheumatology, and persuaded them to organize education program. But the most important for us, it was to accept Cyprus League Against Rheumatism not only as a presenter, but to have an actual role as an associate with opinion on the structure and themes of the program. So our results, it goes that, sorry, it's gone. It's not the results, methods. Yeah, sorry. So our results was that the nurse services were very excited to organize a new education program on such interesting theme. The educational program title, Patient Care with Rheumatic Diseases. Duration of the training was 3 months. The education took place from October to December 2018, and 27 nurses have been educated. The program consists of 1 day per week with lectures from rheumatologists, physiotherapists, pediatrician rheumatologists, podiatric dietitian, psychologists, nurse, patients. And they have also 3 days of clinic exercise on outpatient rheumatology clinic, and 1 day on the daycare department, preparation and delivery of biological and biosimilar factors. Success in the program required to final written evaluation on 60% and case study presentation 40%. CYPLAR, Cyprus League Against Rheumatism, had 5 lectures on the workshop, and this is the part of the program is in Greek. Of course, you cannot understand anything. And CYPLAR has in the program the patient awareness and patient perspective. The lectures were given from organization psychologist staff and from volunteers, patient experts, for giving the patient perception for the treatment and for the self-management of their condition and organization big role regarding the disease awareness, treatment and management. Psychologist lectures and workshops were patient, family, patient-centered care, and patient nurse important people of patient life. Patients lectures and workshop, self-management program, patient expert program, and patient life with a personal experience. So after the program was finished, we designed a survey among the participants, the nurses, and it was to see what it was the most important for them, and also what they are thinking about the program. And the first question was, how much did education help them to understand the rheumatic diseases? And we have that 33% was totally satisfied of understanding the disease, and almost 43% they were very pleased, and 23% they are satisfied. So from this, we can see that the program needs improvement. And then we asked them how much important was the training for them. 57% answer absolutely important, 88% very important, and 14% important. So we can see that this is important. Nurse, they want to be trained. And how much did education help them to understand the needs of patients with rheumatic diseases? 57% answer absolutely, and 33% very much. How important was the presentation workshop of Cyprus League with the title Patient, Family Patient, Care Patient and Sick, Nurse Major Patients of the Patient? Absolutely important, it was 47%, and very important, the other 47%. So we can see that the enrollment of CYPLAR was very significant. And the other question, how much important was for the presentation of CYPLAR's program self-management and patient expert, we saw that the 57% answer absolutely important. This means that a nurse needs to know how to help people with self-management. And on the question for how important was the presence of Cyprus League at the education, we have almost 62% that it was absolutely important. So we see that the patient organizations are becoming more and more famous for the education of the health professionals. And on the other question, how important was for the contribution of CYPLAR throughout the organization of the program. So we put our thoughts and our efforts and our knowledge on the program. We have 62% that it was absolutely important. And we don't have negative answers. So this is for us is very important. And the last three questions that we have 100%, and for me are the most important, and they are proof to the ministry that they don't know what we are talking about, and that they tell us lies that the nurse are not want to be educated or to work with rheumatology fields, is that on three questions, if they are interested to work either on outpatient clinic or inpatient clinic, or to be further training on rheumatic diseases, we have 100% yes. So for us, this is the most important thing. So to conclude, the importance of nurse involvement in the treatment of rheumatic and musculoskeletal diseases is enormous. This has been demonstrated in Europe. Our organization shows the significant role of nurse for achieve the maximum results on the patient treatment. Also, the organization has been able to prove the importance of the contribution of patients to better treatment of the disease. It has also demonstrated to the state the need for a rheumatology nurse, and refutes their excuses. Thank you.